Welcome to the Ticktective podcast, a program of the Bay Area Lyme Foundation, where our mission is to make Lyme disease easy to diagnose and simple to cure. I'm your host, Dana Parrish, and I'm the co-author of the book Chronic, and I sit on the advisory board of Bay Area Lyme Foundation. This program offers insightful interviews with scientists, clinicians, patients, and other interesting people. We're a nonprofit based in Silicon Valley, and thanks to a generous grant that covers 100% of our overhead, all of your donations go directly to our research and prevention programs. For more information about Lyme disease, please visit us at bayarealyme.org. Isabel Rose is a writer, performer, and activist. She champions support for both congenital Lyme disease and rights for transgender children and their families. Rose is working on a memoir chronicling her lifelong battle against Lyme disease, which she passed on in utero to both of her children. She's on the executive board of Project Lyme and co-chair of Mothers Against Lyme. She was the 2023 Project Lyme honoree, and you can listen to her Lyme journey on the Tick Bootcamp. Hello, Isabel. It's so good to see you.
Hi, Dana.
Ridiculously long.
Yeah.
How are you?
I'm getting on. It's like a 12-step, one day at a time, but it is. It is.
So we have been very good friends for many, many years. I won't even say how long. And because I know so many things about your background, it's like I don't even know where to start, because you've had such a fascinating life, such a fascinating journey. You've written a book, you've made a movie, you're an activist extraordinaire. You shine light where people didn't know it could exist. And so maybe we could just start by talking about your own awareness, how that came to be with Lyme and other tick-borne diseases.
My awareness intersects with you, and it begins before you actually diagnosed me with Lyme. It begins in Bridgehampton in my driveway in my car. And I was incredibly depressed, and I was confessing to you that all of my professional dreams had seemed to be, they were taking this sudden backseat to this endless round of doctor's appointments that I was having, because my back was always in spasm, my neck was in spasm, my thyroid was off, my hip, which went on to be replaced twice actually, and that I was also devastatingly depressed I confessed to you in the car, I think, that I was having suicidal kind of urges.
Yeah.
And neither of us knew about Lyme disease, but we had that conversation in my car staring at the lawn.
You were suffering was terrible.
It just was so, and I had this little child then. I only was a mother of one at the time. And I think that my now firstborn, my older child, was already having a lot of issues which I didn't understand. So my life, I was going now from doctor's appointment, physical therapy, constant things. I was dragging her to 1,000 different things.
Yeah.
And all of a sudden, my sense of, my performance career, my writing career, every career was now just being misdiagnosed. I mean, I was misdiagnosed for a horrifyingly long period of time, as were both my children ultimately.
And we should say, you went to the best in New York City. I mean, this is the thing that I constantly point out, because people don't understand. They think they live in a great city like New York or California or LA or San Diego or Nashville, where you have great doctors and these big famous hospitals. You think you're going to the best and that you are going to get the right diagnosis, but it's actually completely not true.
I mean, to this moment, the ignorance, it's almost, I have to say at this point, willful ignorance of a huge majority of the medical world is distressing, especially at particular centers of excellence that focus on, let's say, joints or neurological issues, any sort of psych facilities really best be up to date on the impact of vector-borne diseases on you're functioning.
I mean, you and I both, let's just say we have come together and confronted some of these people at a pretty high level, and they don't want to know, because the amount of money that people spend fixing their symptoms is so extraordinary. I think people don't realize, joint replacements, lifelong psychiatric drugs, and appointments.
My mother was on the board of the hospital for special surgery.
Yeah.
And she even was involved, I think, in the creation of the Pediatric Rheumatoid Arthritis Center. And she was being put on Humira. She was told she had RA. And of course, I was screaming with her for the last 6 years that she has Bartonella, because she had her heart valve replaced. I knew she didn't have RA. And she just got diagnosed with Bartonella, like just separate, not my dragging her to a doctor, but on her regular blood test. It just came up positive. And she is in a state of shock because this hospital let her down so severely. She just can't take it in, I don't think.
And I think we should say, like, Bartonella is a really common cause of rheumatic diseases, including rheumatoid arthritis. You and I hear it all the time. And Lyme was discovered as the result of an outbreak in Lyme, Connecticut, of juvenile RA. I think it was something like 51 kids. And it was a brilliant mother like you, who put this all together and brought it to doctors, scientists, and they found it and named it. And that's what we now know as Lyme. But it causes all these problems people don't know. The thing about your case that astounds me, among other things, is that you and I sat down together and went through your records, and how many, I have chills thinking about it. The most chilling aspect was going through your records and seeing that you had an infectious disease doctor who said, positive Lyme test, false positive, recheck in 3 months. He never even told you, from what I remember. And
it was a CDC positive, and he never treated me.
But he also wrote false positive. And then he would recheck you in the 3 months, not mention that the results were what they were, and it would come up positive again, and he would say it again. I have to say, these stories just literally, like, they're bone chilling.
I'm pretty sure that I got Lyme from my mother, but I was bitten by a tick, a known tick, at 8. And, then had a stiff neck shortly thereafter, and threw up and everything like that. And then began a life that was challenging, and nobody knew what Lyme was then.
Yeah.
But by the time I was getting pregnant and I had, multiple roving arthritises, and I was reporting significant brain fog, floaters in my eyes. I hadn't yet begun to have the Meniere's episodes, but I just had, many things wrong, plus extreme depression.
Yeah.
Nobody ever mentioned Lyme. And I was, allowed to carry a child to term, 2 children to term, and then I lost a child in a pregnancy. But, that's the most distressing thing. I think that the OB/GYN world is so ignorant. It's like these, it's not just my life that's been derailed. It is the lives of both my children, and this is very common. To backtrack, you, Dana, sort of figured out that I had Lyme disease, showed me my records, and I still said to you, no, it can't be Lyme. And I think that is typical, a kind of denial, because nobody realizes the radical systemic hijack.
Yeah.
That Lyme, and I'm using it the way you use it, Lyme plus. So
encompasses all the tick-borne diseases, or multiple. Yeah.
Just the giant hijack. It's,
It's
Yeah.
like long COVID. I think people, now we can sort of frame it. Now the world understands what a common multisystemic chronic infection can do. So long COVID, chronic Lyme, the parallels. You and I wrote, I just remembered we wrote that op-ed together for USA Today. And I think we wrote it in like March or April 2020. I know it didn't come out until sort of early May, but we knew as soon as we saw it, this is very, very eerily familiar. And we were very concerned early on.
I'm not happy that, that it took COVID to bring awareness to chronic lingering post-treatment infection.
Yeah.
But I am glad that people are reconsidering the magnitude, and they haven't even begun to talk about what COVID may be, impacting pregnancy and children.
They're barely scratching the surface. I agree. There's some reports and some data, but I think people don't understand. I'm sure that, just as is the case with Lyme, because they didn't really do anything to stop it or treat it properly or create the right awareness around it, there's not, it's not going to be front page news because it's so horrifying what these diseases can do congenitally, that what are people going to do? What's the average person to do? So we didn't even really explain this, but Lyme is a lot like syphilis. It's a close cousin, as we say. And so all the things that can happen with syphilis can happen with Lyme and do happen to babies. So we should just dive into that because you really are an expert.
Lots to unpack there. We're going to start with, I have 2 children. I was already, definitely greatly infected when I carried my first child. She appeared to be doing really, really well, though. It was a regular pregnancy, a regular birth. And she was then bitten by a tick when she was 4 years old. My pediatrician said to me, if there's no bullseye rash or flu-like symptoms, forget about it. So several months later, when she began to have her first meltdowns from multisensory overload, and when she first began to have difficulty in school after being, in the 99th percentile on all her early tests, I couldn't connect it back to that tick bite. Yeah. Because I was uneducated. And she also
know that only a few strains of Lyme produce a rash. So you just exemplified something very important people need to know. You do not always get a rash when you get Lyme or other tick-borne diseases.
Exactly. She then came home. She started telling me that her joints hurt, and I thought it was gymnastics, or I thought it was growing pains. And then she ultimately, by May, so she was bitten at the end, the first week of November, when she was 4 years old. By that May, her knee blew up. She was rushed to the hospital, and they removed fluid. And I said to the orthopedist, the pediatric orthopedist, wait, doesn't Lyme disease cause knee problems? Could this be Lyme disease? And he said with such derision, he said, I'm not a quack. I'm not going to jump to that. I mean, we're going to let science tell us. And I said, well, you wouldn't want to start her on something right away. And he said, don't be ridiculous. I mean, he was so obnoxious. I remember it to this day.
Oh my God.
So she was put in the hospital. They, because her white blood cell count was crazy. The knee looked like a little soccer ball. I mean, she was 4.
I have a picture of her actually from the hospital. From her laying there with that knee. I'll never forget that.
Her screaming, getting the IVs and everything. She, they found that it was Lyme, and they gave me 2 weeks of amoxicillin. So we all know what that means. That means that her life went south because that was not ever going to be enough to treat a bite that happened in November. It was now May.
Yeah.
And she has struggled, and I got a text message from her this morning saying to me, I haven't gotten my period in 7 months. She's 22. Do you think I need to check again? And she's had constant ovarian, cysts, bursting, terrible problems there. Other than, and many other problems, by the way. She is having hip surgery in January.
Oh no. Same as your hip replacement?
A little bit different.
Oh.
And she's had her own OCD and neuropsych issues that are very well managed now, but they have been extraordinary in what it's meant. The fact that she stayed in school is amazing to me. So, and I know women with really dealing with a lot more. So I think that, I'm not saying like, oh, mine has been the most horrible situation, but this was it. And at the same time, I then had a second child. I had been bitten quite a few more times by ticks. So I was way more infected. And in this pregnancy, I remember I failed my stress test and my gynecologist just said, like, this makes no sense. You're in extraordinary shape. You're amazing. Like, this doesn't make sense. Don't worry about it. I then went for my 36-week sonogram and I was told, so that's the very last sonogram before you have a baby. I was then told that the fetus had failed to thrive in utero. And I just went, failed? Wait, like what? I haven't failed anything since 8th grade. Okay, I graduated summa cum laude from Yale. I'm not, like, fail is not in my vocabulary.
True.
Or my horizon. Plus I'm late for lunch. So can we wrap this up? Like, what do I do to make it grow? So my child was born with microcephaly. We were told from birth that it was going to be a rough road. I lost my baby weight really fast. And the road has been, had its ups and downs. I feel that we are way ahead of the tragedy that could have befallen. I do know other children born with microcephaly who are quite low functioning. My child is really quite high functioning. My child is on the autism spectrum. So is my first. Both of my children are on the autism spectrum. Both, Dana. My firstborn I sort of knew. I didn't want to stigmatize her with it. She came to me to tell me that she had been masking, that she understood that she masks. And that's why social life has always been so hard for her, why she doesn't understand social cues. And we can talk a little bit about what it's like to be sort of with your girlfriends who have these, swans of daughters. And, you're getting this look like you're a shitty mother because your daughter is not a swan. Like, people saying like, why isn't she more polite? Or why isn't she hanging out with all the other kids at the holiday party or something? And it's hard to be the parent of a child who's on the autism spectrum. You're sort of implicated in an uncomfortable way.
Yeah. Blame the mother, as Dr. Bransfield has said historically. This is anytime there's anything going on with a child, whether they're bipolar, schizophrenic, anxious, depressed, autistic, blame the mother.
Yeah, I mean, the only way a mother maybe should be blamed is that they pass it along congenitally, and that is, a terrible guilt to feel, but something that unless you're informed, you have no control over. So it's complicated.
Yeah.
And my younger child has.
Well, you're saying, so just so people understand, you're saying that if you had awareness that you had Lyme, other tick-borne diseases, you had treated them, the birth outcomes can be better. That's what you're saying.
So the birth, I think the significant thing that people need to understand is that if you treat during pregnancy, the birth outcomes may be.
Yeah. Yeah.
It is.
You know of cases where they weren't? I'm just curious because you're educating me here too. I mean, there's sort of a general mantra about treating Lyme when you're pregnant. I don't think it's even controversial. If you're pregnant and you get Lyme, you definitely need to treat it to avoid worse fetal outcomes, potentially bad fetal outcomes. But do you know moms who have treated and still had a bad outcome?
No, I know many mothers who've treated themselves fully throughout their entire pregnancy, and their children still have the whole Lyme package. And,
Wow.
And I'm sorry to tell you this, I hate being the bearer of bad news, but there is a very strong connection between infection in the mother and autism in the baby.
We wrote about this in our book because we interviewed a microbiologist, Dr. Amy Prohl, about this, who I think that it is, if you are somebody who is highly knowledgeable about chronic infections, stealth pathogens, it is not as controversial as the general public would probably imagine that it is to say this.
There's another thing which, again, it is controversial what I've observed, and in my case, one of my children is transgender, and then at puberty actually kind of is now bigender. I want to say that there is a subset of either children born to infected parents or children who get their very own, unique tick bite. And it's just a subset of people who experience gender identity alterations, sometimes sexual orientation changes, sometimes, and Bransfield is much more fluent on this than I am. His deep data that it can cause sexual compulsions, it can cause sort of what we classify as perversion. And what's so upsetting is just that the people suffering from this are sort of classified as criminals, but they're ill, they need treatment. That's heartbreaking to me, and especially the hatred against trans people right now. And I'm not saying that they need to be cured, like they should take antibiotics and be cured, but it is causing it. Let's have compassion around it, and let's also begin to understand if there is, in fact, because mine's a guess, the subset could be a representation of the general subset of the population. I'm just reporting what I observe in my community, because I run these support groups, so I have a pretty constant stream of parents telling me what's going on.
I saw it in your case. And I also know two other people very well who had kids who got a tick bite at some point in, 12, 13, 14 years old, and then changed gender identities, then treated the infection when the family figured out what was going on with other symptoms, and they went back to their original.
I mean,
it's I've seen it with my own eyes.
I'm scared. I'm simply speaking to you as someone, like you. It's just something I've observed, and our own family that is happening. I don't want to pathologize gender or give people even sort of a parent a false hope, I can treat my child for this. The thing is that you need to, if the gender identity change is an indication of infection, it's important to treat the infection, not so much to help the to cure the gender problem, but because the other manifestations of
exactly
are so serious and threatening.
Absolutely. And they can cause heart failure and you can die. I mean, that happens. I just was reading about a case recently of a young boy who got a tick bite. Nobody took him seriously when he was having chest pain, and he died from Lyme carditis. So these things happen. Is there a way to prove, can you test cord blood So people are going to watch this and go, how do you know that that's why your child has X, Y, and Z, or why you had a miscarriage at 8 months? Like, people want to know, how can we find out what's really going on here?
I want to answer that. I want to answer how people can find out, but I want to go back to one point because it's very important that we cover. There is a literally, I would call it an epidemic size, a problem of depression, in young adults, in children, in the population, but I mean, especially in our kids.
Yeah.
And there is a problem with suicide.
Yes.
That number is going off the charts.
Yeah.
And I don't want to discount the connection between infection and suicide in our kids and teens and young adults. And for instance, I think that at college, university health centers, the fact that they're not educated about what Lyme can do. I mean, you can have psychotic break, you can have all sorts of terrifying episodes, and to be dismissed from a health center with a pamphlet on mindfulness, a recommendation for yoga, and to call someone in your network is negligent. It
is. And sometimes Lyme and other infections can just present as neuropsych. This, I had a psychiatrist recently watch the interview I did with Bob Bransfield, who is very, top expert in this field of neuropsychiatric illnesses related to infections. I know you know him very well. He's also published on all of this. He's also published on Lyme and infections and suicide. So this has long been known in the Lyme world and in the chronic infection world. But I think outside of there, not so much. So I had a psychiatrist say to me, should I always be checking my patients for these diseases? Why wouldn't you? I mean, you and I both know psychiatrists don't generally, they say, oh, we know about it, we check for it. Really? I don't know anyone really who had, unless they had a very acute onset and a swollen knee and sort of the more, classically thought of signs. I don't know anybody who just went to a psychiatrist and they were like, before we give you, X, Y, and Z, or make this diagnosis, let's test you for a bunch of infections. I've never heard that. And I've heard thousands of cases.
I want to now go to the question, that you asked me, what can people do? What can mothers do? Because it is a partner of what, where we are right now, in this conversation, that our diagnostic tools are not where they need to be. And that to me is the single, most important issue facing the population, is that we do not have enough dependable diagnostic tools that are available, to the general public. And also with infants in particular, often the infection doesn't show up in the cord blood. Occasionally it does. I do have a mother in one of my groups whose child's cord blood did test positive, but I think.
And what was the child's symptomology?
Well, they're for babies, you're looking at low birth weight. You're looking at like a cardiac issues. You're looking at oxygen. Like, are their fingers blue? Are there, is there rejection? Is there like allergy, in babies?
Do they cry a lot? Do they have more trouble sleeping? Is it
all of it?
that kind of stuff? Yeah.
Yes, all of it. That can be an indication. That could be an indication, but for some reason that our mutual friend Sue Faber knows a little bit more about this than I do, and I hope she can illuminate this conversation around this. The blood tests that they often come up negative. My own blood test came up negative year after year after year, and I was completely infected.
there's a study that showed that traditional Lyme tests, like so Quest, LabCorp, a lot of hospitals that use the same technology, miss 70%.
That sounds like a low number to me. I mean,
I know. Some people would argue it's 90. I mean, it's whatever it is, it's really high, and the tests are really bad. And then if you want to go to a specialty lab that has better tests, you have to pay out of pocket because insurance doesn't want to pay for those. And then you're being gaslighted by the ID community and pediatricians and internal medicine. They don't really know. And of course, rheumatology, the worst. Like, they don't even know how to interpret any of the tests. It's absolutely devastating.
Yeah, I mean, I was left to flounder for 40 years. 40, not 40 years. My kids were left floundering. This is another thing that concerns me a lot, is that there are many women who don't realize they have Lyme disease because the symptomology is not known. It just isn't known. People don't understand that their tendinitis is, Lyme disease. They don't understand that their anxiety or their tic, that they blink their eyes a lot. They don't understand that and their tennis elbow are really good clues.
Yes.
And then they have a child who's definitely like on the spectrum, and they don't understand that in and of itself is a clue, that they have a family situation going on. Yeah. I identify it, very quickly now because I'm inside of it and I see it in seconds. I can look at whole generations, by the way. I was just thinking about this the other day. A grandfather, very, very sporty family, house in Aspen, all athletes. Granddad, now Alzheimer's. Son has some sort of degenerative spine condition. Daughter is bigender and on the spectrum and an insomniac from, the age of, from pediatric age and to this day. I can look at that 3 generations and tell you that there's infection 3 generations, a triple Lyme. And that's just an example. I see it all the time in different manifestations because I know all the symptoms like you do.
And neurodegeneration is a very well-known symptom, like Alzheimer's, dementia, Parkinson's, of Lyme. We've known this for generations, and yet there's almost zero public awareness. It's just huge. It's huge, and nobody knows. It's just absolutely a global phenomenon. Nobody knows because it's all been covered up.
I find myself, incredibly overwhelmed by what I know. And I often say that people, they just don't realize the size of the catastrophe.
Right.
The size.
Yeah.
And I hear all the time. So a mother is chronically anxious or something like that. The child is fine. They just have crippling stomach pain. Mm. And I'll say, has your child been tested for Lyme? And they'll just say, don't be ridiculous. I'm dismissed. I sometimes just say, I wish I didn't know what I know.
Yeah, I know what you mean. It's a curse and a blessing at the same time.
And, they'll just say, well, she's been tested for everything and they just can't figure out. And I'll say that's usually when you need the Lyme test. But then if the Lyme test comes back negative, you are doubly confirmed.
I know. Well, that's the problem. I don't even say test anymore to people. I say, have you been evaluated? Because it should be a clinical diagnosis based on signs and symptoms. Testing can confirm. There's other blood tests that you can use, inflammatory markers, things that give clues, CD57. But you need to go to a specialist. You cannot just go to your regular pediatrician or your ID doc at NYU. You cannot do that. That is not going to get you these diseases ruled in or out properly. You have to see a specialist. ilads.org has a good resource list of doctors a network of doctors all over the world, ilads.org. Bay Area Lyme.org does just Project Lyme. I want to talk to you a little bit about
Project Lyme has a doctor referral list.
Great. Project Lyme is another great resource then.
I mean, there's another issue that I think the Lyme community has to solve, in itself, which is that people are desperate for some cure because they're really sick, and the sickness shows up in so many different ways. So it means that there are some practitioners out there who maybe they're helping some people, but they're not helping everybody. Or there are some ruthless practitioners out there who shouldn't be helping anybody, but they
Right.
taking our money. And it gives the Lyme world a difficult reputation, sort of like a public face. And that's something that I do think about a lot. In the absence of clear guidelines of how to treat, because there are no guidelines. The CDC has not offered, well, there are Lyme treatment guidelines and they're not effective. They're incorrect. And the IBSA, these are terrible guidelines that
Right. Exactly.
for pregnancy, there are really no guidelines. But in the absence, it's a free-for-all.
Yes.
And so and every case is kind of different and every body is different. So, and so there's like the narrative that's sort of leaking out is potentially, damaging to a community that in its essence is just trying to get better.
Yes. We're seeing this in long COVID now. They're going down a lot of the same roads. Okay, Western medicine has nothing to offer me, or very little to offer me. I'm going to do Chinese medicine. I'm going to try hyperbaric oxygen. I'm going to try LDN. I'm going to an integrative doctor. I support that, all that stuff. And I totally agree with you. Part of the reason that this is happening is because we don't have good treatments. So then come up with better treatments. Like the mainstream really wants to help people instead of complaining about the fact that we go down these other roads. Help us get better then. We're all for it. Chemotherapy kills a lot of people. Tylenol kills a lot of people. Nobody's screaming on the front pages about that. But God forbid a Lyme patient tries something a little bit outside of the norm. It's like, oh my God, that doctor is crazy. That patient is crazy. Well, guess what? Sometimes they also get better doing these alternative things. I did Chinese medicine. I did Western medicine. I got better. They synergized. I did great. I did both. I was in heart failure. I came out of it. You're going to argue with me about it? Like, that's what happened. If you have a problem with it, that's your problem.
I think that we are in, sadly, early days. I mean, for those suffering over many generations, it seems like, how could this be early days? But if you do take syphilis as your model, began to get cured in 1940 something.
Yeah. But there's not a real great effort. There's not a lot of money from the NIH to fund Lyme. They're really looking to push another vaccine, and there's a lot of scandal around the lack of treatment, the lack of funding.
Just understand, doctors like ILADS actually published that no further investigation into congenital Lyme was recommended.
Really?
That's not even a scientific frame of mind. I mean, questioning and investigation is at the heart of science.
Of course. Well, the CDC even now acknowledges that congenital Lyme exists and is a problem. So for a long time, they wouldn't admit it publicly because what they'd say in private is, if we acknowledge it, we have to do something about it. And we don't have the means to do anything about it. Well, you do actually. You could just educate people. You don't have to do much more than that. You could just tell them about it, give them the opportunity to treat if they if their doctor and them decide, this could help.
It could help. And the thing that disturbs me and makes it hard for me to sleep some nights is that I can't say with assurance to the women who come to me for advice. I cannot say to them at this time, if you treat yourself through pregnancy, your baby will turn out well. I'm unable to offer that comfort right now. And the only advice I can offer is to make noise and to ask or to call for more research. But this is years down the path. And what happens if you just want to start your family?
Yeah. And all these women are asymptomatic. Also another big problem is many, many, many people are asymptomatically infected, but then they have a child that's highly symptomatic. So that's, it's a really, really enormous issue.
I have women. So one woman in my group. So I have these support groups, and they're sponsored by Project Lyme. I'm a board member there, but they're run by me through Mothers Against Lyme, and I'm the co-chair of that group.
How can people join these, by the way?
They go to Project Lyme, and if they scroll down on the page, they'll see join a mother's meetup.
Oh, great. Okay.
And so I get a lot of the population of these meetings is varied. I have many women who don't have Lyme at all, or they don't think they have Lyme, and they have an adult child with Lyme who's housebound. Maybe they're 30, the kid is 36, 20, whatever. These women have, their lives have fallen apart from the strain of having an adult child never leave the house. It's terrible. The mourning, the cost, all of it. Then I have women who have Lyme themselves and children with Lyme, and then I have women who have just the mothers and the kids, just the kids, adult kids. That's generally my population. One woman wanted to get pregnant. She definitely had just gotten positively diagnosed with Lyme, and she wasn't going to treat. She didn't have the money for it. And another woman in the group said, you should really think about whether you want to have the child.
Wow.
So that mother, I didn't say it. I didn't have the guts, but the mother to be just signed out of the meeting, kind of ran.
Yeah.
But
it's harsh. It's a harsh reality. It is so harsh.
It is really true, Dana, that the stress and strain of raising children who are sick, it can't be overstated how great that stress is, and the toll it takes on the mother, on the parent, on the marriage. Marriages regularly fall apart over this.
Yeah.
It's not just people lose their careers. You know what the story is. They lose their careers, they lose their marriages, they lose all their friends. It's isolation is a terrible problem, and despair is a terrible problem.
And people don't really believe them. They don't believe it can be this bad. They question you. They question it. Come on. Is it really Lyme? Just tell the kid to put on their shoes and socks and let's go to lunch. We said we're going to do this. That's not how it always works. Like, you don't get it if this is what you're saying. It's very distressing because you have the element of not being believed on top of everything else. If you had a child with diabetes, they believe you. If you had a child with cancer, they believe you. But somehow when you have Lyme, it's the diagnosis of disbelief. It pervades everything.
And being gaslighted.
Yes.
I have to fight myself against kind of daily despair, and I have to celebrate frequently the small victories, a medication that's working, a symptom that gets relieved, or I have to cultivate that. Otherwise, I don't know that I could step forward. I wouldn't get out of bed.
Yeah, I understand that. It's very, very hard. It's very, very hard. It's a family. It becomes a family affair. Your parents then are affected, like the grandparents, everybody is affected by this. It's
I don't know why. So medical schools are going to have to start teaching it. It's going to start there.
yeah.
Symptom awareness is going to be our greatest ally, and improved diagnostics and a public awareness campaign so people can keep themselves from getting Lyme and their children from getting Lyme. But in the congenital situation, we really need the diagnostic to step in because, like you said, it's not going to capture someone who's asymptomatic or who doesn't understand that their little list of kind of small things, or maybe big things, who knows, but they don't understand that's Lyme.
Yes.
They're like, no, I have Crohn's and I have my thyroid's off, and I'm depressed, but I don't have Lyme.
Right.
And I'm like, well, but I'm going to take your phrase, have you been evaluated? Also, somebody who's young, with like RA or something like that, if you say to them, you should get yourself evaluated, they don't want to take the time to stop their life and sort of figure out where to get a Lyme literate assessment.
Yes. And, I have a friend who has RA and has rescued stray cats her whole life, which carry Bartonella, very high level, which can cause RA and other rheumatic issues, as we talked about before. And I've said to her, you probably want to check this out. You're on immune suppressants. She's always sick because she's on immune suppressants. And now we're like in the era of COVID and she's even more always sick. And she said, I don't want to. Why not? Because I just want to feel better and the immune suppressants shut down my symptoms. So I'm not getting worse. I'm not getting better, but I'm not getting worse. It's hard to argue with that because I don't want you to feel worse either. I want you to feel better too. But it's also so complicated because I can't promise you treatments are going to work. So
it's why I feel that we are in early days. And I think that the future will show us a very big connection between infection in general.
Yeah.
Not just Lyme infection, but infection.
Yeah.
And, negative outcome that isn't immediately associated with that initial infection. So if the first manifestation of COVID is a cough and a fever, 6 months down the line, when you have neuropathy and dizziness, what does it look like in its chronic form?
That's a great point. Excellent point.
So we need to be. I think that eventually they'll be making a lot more connections between infections, and I also just think, Dana, that I want to see the numbers, and all the statistics, of course, are skewed because of people who don't identify themselves in this category. But I want to see if there's correlation between Lyme endemic states and autism, Lyme endemic states and gender dysphoria, reported gender dysphorias. I'm really curious about it. And Lyme endemic states and suicides. Like I want maybe these statistics will get more attention.
Yeah.
I recently saw a statistic. It was from 2015, so old. 80% of marriages where there's an autistic child end in divorce.
And in the general public, it's like 50, right? So that's significant.
It's significant. So if you think about that, and then you think about that there's a very strong connection between Lyme and autism.
Yeah.
If you want to help the population, you need to go to that source. You need to go to Lyme. And I don't know what the government gains by their negligence or by their kind of ignoring it or hoping it'll just solve itself.
That's a much bigger topic. My view is it's pharmaceuticals. We did a great amount of research on this for our book, and we wrote about it pretty extensively. Well, you and I both know the market for immune suppressants is enormous. It's billions and billions and billions of dollars a year. So And we also know that infections cause a lot of the symptoms that these immune suppressants are treating. So there's no money in cures. I always say chronic illness is a cash cow. There's not a lot of money in cures. There was a big analysis that's been made public and written about in the mainstream on Harvoni, the hepatitis drug, which actually cures certain forms of hepatitis. And they did a big analysis on Wall Street and said it's just not that profitable. So yeah, I'm just making this up, okay, 10 billion in the first year. But then as you cure people, you're going to get down to 1 billion. It's just not really worth it. I mean, this is literally how it works. And it's hard to believe because people want to believe we as humans want to do good. And it's actually,
no, but let's think of what about a hospital? Listen, a hospital makes a lot of money.
Yes.
Sending you for your MRI and for your PT and for your epidural injection and for your, hip replacement and for your all these different things. And it becomes this endless cycle. But it's a for-profit. Hospitals got to pay for themselves. So I'm looking at the time and I'm like,
I know we have to go. Isabel, thank you so much. You are a gem. You're brilliant and you have so much insight and you are helping so many people. So thank you for today. Thank you for your time. And thank you for everything that you do.
Thanks, Dana. Thanks for chatting with me.
Thank you for joining us for this episode of Ticktective, a program of the Bay Area Lyme Foundation. For more information or to get involved, please visit us at bayarealyme.org.